Hi, I'm Peyton Chang. I am a first year EOH student, and I do research with Dr. Lance Price on antimicrobial resistance here. I'm here with Lieutenant Colonel Victor Suarez, who just finished up his one-year fellowship. He's here from the Army War College, and I just had the privilege of attending Lieutenant Colonel Suarez's seminar on his final project. I know you're doing a fellowship with us in the Environmental Occupational Health department here, so how has the public health that you've learned here influenced your project, and what will you bring back to the Army War College?
First of all, it's wonderful to be here, Pei-Ying, and I'm honored to be here as part of the George Washington University's Milken Institute School of Public Health as a U.S. Army War College Fellow. And it's a unique program in that some of us Army officers are allowed to go to our senior service college at an academic institution or a think tank to do important research to bring something of value or to resolve a problem within the Army with academia, partnering with nonprofits and other institutions. This year I was fortunate to take a full load of classes here in the School of Public Health in a variety of departments to augment my research project. And my research project was to solve a health readiness problem within the military. And I looked at different ways and means that we could improve the health of our force, not just to get them deployable ready, but to make sure that we create a system so that they could be healthy for their whole lives, not just the time they're in service, but extending throughout the rest of their lives, even post-service.
Was there a particular reason that compelled you to pick this topic here at George Washington University?
Well, thanks for asking about that. Yes, there was. I've been in the military for about 21 years. I've deployed 3 times, twice to a combat zone. And what I've seen over about a 21-year career in the military is that we do a really good job of keeping our service members fit and ready to go to war, but we struggle with maintaining their health, their long-term health and well-being throughout their whole lives. And I wanted to see if there was a way, or there was multiple ways where we could do something a little differently and maybe look at health in a different way. And so what I wanted to do when I was here was to have access to some of the best experts in this School of Public Health throughout all the various departments, to include EOH and the Sumner Redstone Center, offered a variety of experts that I was able to tap into to help maybe look at this problem a little deeper and come up with a strategic way where we could actually bring something of value back to the Defense Department to improve health. And I'm personally passionate about this subject because I've been a commander multiple times, and I've seen the challenges that we put our service members through when we deploy them, we bring them back. There's a lot of challenges with moving on a regular basis, and there's a lot of environmental threats, there's a lot of cultural behavioral threats to our health and our well-being, and I wanted to see if there was a new way that we could go ahead and solve this problem in the 21st century. So.
I was at your seminar and I really liked it and appreciated it, but if for anybody who isn't there, can you just talk about 1 or 2 key points, the main takeaway?
Yeah, absolutely. So I think the 2 key takeaway points that I would say that my research brings to light is, 1, the National Defense Authorization Act of fiscal year 17 allowed for the first time for incentives to be put into our health insurance plan, or what we call the TRICARE health insurance. And that currently is limited to beneficiaries that are non-uniform people. So this would be dependents of military retirees, children of military, that would be able to go into these disease prevention, health promotion programs that are based on incentives like discounts on your health care insurance or other incentives. One thing is that I talk about in my paper is that we could also explore those types of programs that have been used quite well within the civilian sector for uniformed service members via some type of a pilot program to test how that would help improve or help reinforce healthy behaviors for the military uniformed service members. The second thing is really implementing a health risk assessment portion of our annual health assessment process. Currently, the health assessment that we do is a very binary in nature. It's really designed on a find and fix treatment methodology. Therefore, you look for current and past diseases or injuries, and you record them and look for deploying limiting conditions, versus a health risk assessment, which would focus on looking at health risks in the various components of one's health and well-being, provide some type of a risk-based score on a continuum of, let's say, a 0 to a 100 scale, and also then use techniques and procedures such as predictive modeling and predictive analytics to determine whether or not things that you're seeing in that person's health risk could predict a future injury or future ailment, so as to disrupt that disease progression at the right time.
Mm-hmm.
So I think those are the two main things I'd like to see people discuss and advance further from my research.
So prevent, detect before you have to respond.
Absolutely, and it's unfortunate that, you know, we've been using more of a find and fix treatment methodology, but that's served us well for an operational environment where we have to perform acute services or trauma care, and that works fine within that environment because, you know, those are the kind of skill sets you need. But when we're talking about health readiness, or we're talking about optimizing one's health, helping people reach their health potential in a non-combat environment, we're talking about a different set of skills and a different set of environment where you need to have transformative thinking, where you can look at different aspects and all the determinants of one's health, and actually reduce those risks one by one.